Welcome back. My name is Lucy. I am a pharmacist and a nurse. In this video, we will be going over the medication Metformin, its uses, dosages, side effects, and drug interactions. As always, all information in this video is for informational purposes only and is not intended to serve as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider. What is Metformin? Metformin is an anti-diabetic agent that belongs to a group called guanides. Metformin is usually the first-line treatment of type 2 diabetes mellitus when lifestyle changes alone are not sufficient. Metformin lowers blood glucose level using 3 different mechanisms. It reduces the amount of sugar that your liver releases into your blood. It helps your body respond better to insulin, and it also decreases how much sugar is absorbed from your intestines. It has multiple brand names: glucophage, Riomate, Fortamate, Glumeta, and it comes in tablet or liquid form. The tablets come either as immediate release or extended release. Metformin also comes in combination with other oral anti-diabetic agents, and I have included them here. Some of these combination products are not available in the United States. Metformin has an FDA indication for treatment of type 2 diabetes, but it also has off-label use. And for off-label use, it can be used for gestational diabetes. And when it's used for gestational diabetes, your healthcare provider might need to increase your dose during your 3rd trimester due to increased clearance, and some patients might end up needing insulin. It also can be used for prevention of type 2 diabetes, and for prevention is used for select patients with prediabetes with a BMI of greater than 35, age less than 60, and patients with prior gestational diabetes. Also, it can be used for polycystic ovary syndrome, PCOS, and it can also be used for antipsychotic induced weight gain. Uncontrolled blood sugars are associated with long-term damage to body tissue. It can lead to kidney damage, blindness, heart diseases and heart attack, stroke, nerve problem, loss of limbs, and sexual function problems. Metformin dosages range between 500 mg to 2,550 mg. And on this table, the doses that are taken multiple times a day are the immediate release tablets or the liquid form. The ones that are taken once daily are the extended release tablets. To minimize side effects, the therapy is usually initiated with 500 mg once daily and titrated up in 500 mg increments every couple days to weeks based on patient tolerability. Metformin should be taken with food to help minimize the abdominal side effects. And for the extended release tablet, you should swallow it whole. Do not crush, cut, chew, and it should be administered with the largest meal of the day, which is typically dinner for most people. If you're taking the extended release tablet, don't be alarmed if you see a ghost tablet or a capsule in your stool. The ghost tablet contains only the outer layer of the tablet with no active ingredient. So don't think that the medicine did not dissolve or you didn't eat it not right. If you're taking the solution, Riomate, use the supplied dosing cup to measure the medicine just to make sure that you're getting the right dose. Riomate is a good option for people with swallowing difficulties, but it is more expensive compared to other formulations, which if you have difficulty swallowing, the immediate release tablet can be crushed. Metformin may cause various mild and or severe side effects. The most common side effects are gastrointestinal related side effects. These are nausea, bloating, gas, diarrhea, constipation, and abdominal pain. To help avoid the gastrointestinal symptoms, your healthcare provider might start the medicine at a low dose and go up slowly. And also taking metformin with meal will help with the side effect. And if that doesn't help, switching it to an extended release tablet might help with the gastrointestinal side effects. The GI side effects typically occur at the initiation of therapy, but late onset of diarrhea has been reported. The adverse reaction decreases after several weeks of therapy. However, some patients require discontinuation. Metformin also has some rare side effects like metallic taste in the mouth, headache, rash, lactic acidosis, anemia, and hypoglycemia, and also decreased appetite. There are some risk factors that can increase the side effects of metformin. These include liver disease, kidney disease, heart diseases, previous allergic reaction to metformin, concurrent use of certain drugs that impair kidney function, dehydration, excessive alcohol consumption. Older age, so age greater than 65 years old, are at increased risk of having metformin side effects. Metformin can cause two rare severe side effects. These include lactic acidosis. This is where the pH or acid level drops in your blood and can result in hypothermia, hypotension, bradycardia, and death. Lactic acidosis has non-specific symptoms that include stomach pain, nausea, vomiting, muscle pain, trouble breathing, feeling very weak, tired, uncontrolled, or slow heart rate. Risk factors for lactic acidosis include heart disease, especially recent myocardial infarction or heart attack, excessive alcohol consumption, liver disease, and kidney disease. Also, be aware if you're getting a medical procedure that requires IV contrast like MRI or CT scan or even an angiogram, that you might need to stop the metformin prior to the procedure and probably 48 hours after the procedure to help reduce the risk of lactic acidosis. Also, metformin can cause vitamin B12 deficiency, and this happens because metformin can affect vitamin B12 absorption. This can lead to irreversible issues like neuropathy, anemia, signs and symptoms of depression. The risk factors for B12 deficiency are low calcium level, which calcium and B12 depend on each other for absorption. So if your calcium is low, your B12 will be low due to less absorption. You can take B12 from food sources like beef, chicken, fish, fortified cereal, milk, and dairy products. And if these dietary sources are not enough to provide B12 supplements are available as tablets, and they are over the counter. And also, people with oral abdominal absorption issue can get intramuscular or subcutaneous injection to help with B12 deficiency. Metformin can have interaction between one or more co-administered medications, which can lead to reduced therapeutic efficacy or enhanced toxicity. You can see on this table things like contrast media, iodine can increase risk of toxic accumulation of metformin, which can lead to lactic acidosis. Also, medication like topiramate that is used for epilepsy or migraine, and also medication methazolamide, which is used for glaucoma, can increase the side effect of metformin. And also, excessive alcohol use or non-steroidal anti-inflammatory medication like ibuprofen and naproxen. Also, in the middle, this medication increased the serum concentration of metformin. So medicine like selegiline, which is used for Parkinson, Zofran, which is used for nausea and vomiting, ACE inhibitors that are used for blood pressure, some antidepressant medication like Zoloft, Prozac, or Lexapro, all those can increase the serum concentration of metformin. The medicines that can decrease the therapeutic effect of metformin are medicine like verapamil and thiazide diuretic, and also patiroman. So if you're taking patiroman and metformin at the same time, make sure to administer metformin 3 hours before or 3 hours after patiroman to help reduce the risk of underabsorption of metformin. Thank you for watching. Please like the video and subscribe to the channel if you like to see this type of content, and also hit the notification bell so that you can be notified of any future videos.